In this video, I'm going to demonstrate how to save a choking adult or child, whether conscious or unconscious. When a person chokes on something, this blocks the airway. If mild, the person can cough and cough out the obstruction and resume breathing. If severe, the person may use the universal sign for choking, which is grabbing the throat with one or both hands, indicating they cannot breathe or speak. The Heimlich maneuver is a technique you can use to help this adult or child choking victim. Stand behind the victim. Wrap your arms around their abdomen. Make a fist with one hand and place it slightly above their belly button or umbilicus. Place your other hand over your fist. Make a thrusting motion with your fist or hand upward and back. Continue giving thrusts until the object is dislodged or the person stops responding. If the person stops responding, lay them down and start CPR immediately and call for help and an AED. For a very large person or pregnant woman, you may place your arms under their armpits and thrust over the breastbone instead of the abdomen. Any person who has received thrusts should follow up with their healthcare provider.
If you need to administer an EpiPen for yourself or others, it's easy to use in 2 simple steps. If there's an emergency, these 2 simple steps could save your life or someone else's. Hold the ergonomically designed EpiPen in your hand and 1. Pull off the blue safety release, which will unlock the device. Now the EpiPen auto-injector is ready to use. A clear window shows if the EpiPen has already been used. If the clear window is obstructed in any way, or if the device does not fit into the carrier, it should not be used. 2. Place the orange end of the EpiPen against the outer mid-thigh and push firmly into the thigh so it clicks. Hold it there for approximately 10 seconds to make sure all the medicine is delivered. Seek emergency medical attention right away. Take the EpiPen auto-injector with you to the hospital emergency department. There is no need for concern about an exposed needle, since it is protected both before and after use. You'll also find easy-to-read instructions printed on the EpiPen auto-injector. It's as simple as 1, 2. Remember these 2 simple steps and always keep your EpiPen auto-injector close at hand to stay prepared.
Hi, I'm Laura Stokes from Anne Arundel County Fire Department. I'm a 20-year veteran in charge of EMS quality improvement. An AED is an automatic external defibrillator. This is a device that, applied to the chest in a patient with sudden cardiac arrest, starts the heart again. It's important that we start the heart quickly. For every minute without CPR or defibrillation, the chances of successful resuscitation are 7 to 10% less. The American Heart Association has recommended that the 2 most important interventions in saving a sudden cardiac arrest victim are early defibrillation and CPR. Many places have AEDs that have automatic alarms. Security is called, and the call is called into 911. A lot of technology is within these facilities. However, some is not, and these are simple little AEDs that are kept on a counter or a tabletop. Make sure that 911 has been called. This is the AED. A typical AED will have a container and an attached bag. Open both. Once they're open, you'll find that it's a very simple device with an on-off button and a shock button. Remove the pads from the container. These are sticky. Peel them off and apply them as shown on the chest. Once these are applied, you'll turn the device on. It'll then prompt you the rest of the way. When the device is turned on, you'll hear a beep.
Remove clothes from patient's chest.
As you can see, it's very simple. Once the clothes are
Peel
removed,
white pads from gray plastic case. Attach pads to bare skin exactly as shown.
it walks you through every step.
Remove clothes from patient's chest.
You are not going to get a big shock. What happens is the defibrillator is placed on the patient's chest. Once it's on, a single button is pressed and the rhythm of the heart is analyzed. There's a rhythm called ventricular fibrillation that we need to shock in order to get the patient out of sudden cardiac arrest. This device monitors that rhythm and shocks all by itself once you press a button. There's no chance of you being shocked.
Oh my gosh, Maria, are you okay? Maria, are you okay? Go get the AED.
Once you see that a sudden cardiac arrest victim has fallen to the ground, check for a pulse. Are they breathing normally? If not, begin CPR immediately. You'll want to put your hands in the middle of the chest, on the sternum, and compress at least 2 inches, at least 100 times per minute. You can use the beat from Staying Alive, the song. This is an AED. It says defibrillator. It doesn't say AED. It's the same thing. You'll find it located at the elevators within the hospital, and at a lot of other places, it may be available outside major stores, malls, airports, and the like. As you open up the cabinet, you'll notice that it has lights and a lock. The alarm will sound. That's a good thing. We want help to come to you as soon as possible. Don't hesitate to open the cabinet. It'll also say, trained responders only. If you're watching this video, you're a trained responder. Once the cabinet's opened, you'll find the small defibrillator located inside. Michelle's now going to open the case. While Brooke is doing CPR, Michelle's going to turn on the AED monitor using the green button.
Remove clothes from patient's chest.
For simulation purposes, we'll be opening Maria's code only.
Peel white pads from gray plastic case. Attach pads to bare skin exactly as shown.
If your patient's more than 55 pounds, you can use the pads as they are. If it's a pediatric patient less than 55 pounds, the pediatric adapter will have to be plugged into the unit. Pull the adapter out. You'll notice it says less than 55 pounds. It has instructions to place this on top of the AED device and plug it in. That's all you need to do. The pads come in a case that's self-adhering. Pull back the pads to remove the sticky and apply them as shown. Once you've applied the pads and the patient's rhythm has been detected by the monitor, it may tell you to shock. Clear everybody away from the victim and press the orange shock button. The patient may twitch or jump a little. That's normal. Begin your CPR right away. Remember, it's important to continue CPR and the AED until help arrives. Don't forget to join us for Save a Life Annapolis CPR Day, Saturday, March 10, from 9 a.m. to 3 p.m. here at Anne Arundel Medical Center. And thanks a lot.
Epilepsy in the classroom. Epilepsy is a medical condition that produces seizures affecting a variety of mental and physical functions. It affects 3 million Americans, and with 60% of cases occurring before young adulthood, As a teacher, you will most likely have already seen or will see at some point a student with epilepsy in your classroom. A seizure is when a brief, strong surge of electrical activity affects part or all of the brain. So what might cause a seizure? Some common triggers can be missing medication, stress, anxiety, worrying, or anger, fluctuating sleep and wake cycles, hormone fluctuation, photosensitivity or external stimulus, or in some kinds of epilepsy, internal mental processes such as math calculations can trigger a seizure.
Epilepsy can influence cognitive functioning by impairing attention, reading and language skills, arithmetic learning, motor skills, memory, behavior, and organizational skills. Epilepsy can also impact socio-emotional functioning in many ways. These include social rejection, a fear of dating, loss of driving capabilities, or anxiety about athletic participation. Fear of having a seizure, fear of embarrassment, and implied self-concept, as some peers may mistake epilepsy as being a contagious condition. Lastly, epilepsy impacts day-to-day functioning. Students with epilepsy must remember medication and become both self-reliant and self-advocates. They need to try to be proactive in many things such as dietary needs, sleep, and organizational habits. Finally, it is important to make wise health decisions because lack of sleep, alcohol abuse, and staying up late can increase the occurrence of seizures.
Here are a few simple steps to follow if a seizure occurs in your classroom. First, keep calm. Reassure the other students that the student will be fine in a minute. Second, ease the student gently to the floor and clear the area around them of anything that could cause injury. Third, put something flat and soft, like a folded jacket, under their head so it will not bang against the floor as their body jerks. Fourth, turn them gently onto their side. This keeps their airway clear and allows any fluid in their mouth to drain harmlessly away. Do not try to force their mouth open. Do not try to hold their tongue. Do not put anything in their mouth. Do not restrain their movements. Fifth, when the jerking movements stop, let the student rest until full consciousness returns.
If consciousness does not return, begin CPR immediately. Here are some things to consider if you have a student with epilepsy in your classroom. Number 1, for memory and organization issues, consider mnemonic devices, color-coded notebooks, and repeating lesson strategies throughout the lesson. 2, make the student feel comfortable in the classroom. If a seizure does occur, make the student comfortable afterwards. Discuss with your student and his or her parents if they would be okay with you discussing the facts of epilepsy in your classroom so that all of your students will feel more knowledgeable, comfortable, and prepared should a seizure occur. 3. Be prepared for seizures in the classroom. Have a designated area for the student to go to. Have written management of medicine times available, and possibly assign classroom helpers to assist during a seizure.
4. Management of different types of seizures. For an absent seizure, make sure the child did not miss any key parts of the lesson. For a tonic-clonic seizure, first aid protects the child from injury while seizure runs its course. For a partial seizure, if the child is confused or frightened, comfort and reassure. Help reorient the child if they are confused. While this is happening, do not grab, hold, or speak loudly. If the child resists, just make sure he or she is not in any jeopardy. Number 5. Discuss with the students and their parents about having a classmate accompany them to classes, so they aren't walking the stairwells alone should a seizure occur. Number 6. Be willing to change workload. Students with epilepsy will have good and bad days. If they are fatigued or having low energy, provide a lighter, more achievable workload. On good days, allow students to thrive by giving more challenging assignments.